Hello everyone, Rikta this side. Welcome back to Medicine Nursings. So in the previous class, we have discussed regarding what is infections, microorganisms, which all are coming under this microorganisms, and the basic terminologies regarding the infections. So in today's class, we will be discussing another important topic from these infections, that is classifications of infections. So this is very important topic. Sometimes in exams, MCQ came like one straight line will be given and the options will be this is which kind of infections. So for that you need to know about all classifications of infections. So here I have listed down all the classifications like primary infections, secondary infections, superinfections, reinfections, hospital acquired infections, opportunistic infections, iatrogenic infections, atypical infections, subclinical or inappropriate or pre-infections, all will be coming under in one classifications. Okay, subclinical or inappropriate or pre-infections, and the last one is your latent infections. So here we will be discussing one by one all the major classifications of infections. So coming to the first classifications, that is primary infection. So what is primary infection? Primary means for the first time, that person's initial exposure of the pathogen with the host. For the first time the person is getting the infections. Before that he was completely healthy. So what is the definitions of primary infection? Primary infection means the initial infections. Okay, initial infection caused by pathogen in a healthy persons with no prior infections. Okay, so for the first time the person is getting the infections. Before that he was completely healthy. Now once he got the infections, now somehow his immunity will be compromised and subsequently he will got the infections. When the second time he will get the infection, it will be coming under secondary infection. That we will discuss later. So what is primary infections? For the first time the person is getting the infections will be coming under primary infections. Okay, so any infections, let's think it is the common cold caused by coronavirus, so that will be coming under primary infections. He never suffered with this common cold caused by rhinovirus. So when for the first time he got this common cold, it will be coming under your primary infections. Now another one examples, primary TB, okay, caused by Mycobacterium tuberculosis. Okay, the persons who never had this TB, but for the first time this primary tuberculosis caused by Mycobacterium tuberculosis will be coming under this primary infections. I hope it's clear. Now coming to the secondary infections. What is secondary infections? Secondary infection means this secondary infections occurs during or after the primary infections. As these primary infections weaken the immunity systems, now he is immunocompromised. Now subsequently he will get the infections. That all will be coming under your secondary infections. So when this secondary infections occurs during or after the primary infections, when the body's resistance is lowered, okay, or compromised. As it is compromised, now resistance power decreases. That's why he got these infections or different infections against. Okay, so if I given one examples of a patient with measles, that persons or patients already suffering with measles, now due to measles his immunity power decreases. That's why he developed pneumonia. So this pneumonia is the secondary infection occur in these patients when he was suffering with this measles. That's why it is a secondary infections. Due to measles his immunity power decreases, and the second time he got these infections of pneumonia. So this pneumonia is coming under the secondary infections. I hope it's clear. Now coming to the third classifications, that is superinfections. Okay, now what is superinfections? When a new infection develops on top of an existing infections. Okay, that can be usually due to antibiotic resistance organism. after antibiotic use. So what is the meaning of this superinfection? Superinfection means exposure by a pathogen when already the person is suffering with an another infections. अभी वो इन्फेक्शन पूरा गया नहीं है, पूरा क्योर नहीं हुआ है, उसके ऊपर पेशेंट को एक नया इन्फेक्शन अराइज हो गया. सो व्हेन अ न्यू इन्फेक्शन डेवलप्स ऑन टॉप ऑफ एन एग्जिस्टिंग इन्फेक्शंस, सो दैट विल बी कमिंग अंडर योर सुपर इन्फेक्शंस. ओके, let's think and giving an examples of candida. Candida infections occurs. Candida infection developing after prolonged antibiotic therapy. Antibiotic therapy. Okay. So patient is already having an infections. Because of that, patient is taking antibiotic therapy. Okay. Patient is already having one infection. Due to that, patient is taking antibiotic therapy. Now, because of this prolonged antibiotic use, his normal body's normal flora or normal protective antibiotic getting and protective bacteria getting decreases. Due to that, his resistance power or immunity power got decreases, and that's why easily he got this candida infections. So he is not fully recovered. He is already suffering with an infections. On top of that, he got a new infections. That will be coming under your super infection. I hope it's clear. Now coming to the fourth infections, that is reinfections. Reinfections, in that name itself you can understand repeating. Okay, so what is the definition? When a person recovers, reinfections, recovers from an infections, already recover कर चुका है, but gets infected again by the same organism. Okay, so that will be coming under your reinfections. So what is the difference between superinfection and reinfection? Superinfection means patient fully recover नहीं किया, ऑलरेडी पेशेंट के पास एक इन्फेक्शन है, फुल्ली रिकवर करने के पहले ही दूसरा एक इन्फेक्शन उसके बॉडी में अराइज हो गया, दैट इज कमिंग अंडर सुपर इन्फेक्शंस. नाउ व्हाट इज रीइन्फेक्शन? रीइन्फेक्शन मीन्स पेशेंट के पास इन्फेक्शन था, पेशेंट फुल्ली रिकवर कर चुका है, नाउ अगेन he got that infections by the same organisms after recovery. That is the difference between reinfections. So super infection arise होते हैं before recovery, reinfection arise होते हैं after recovery. I hope it's clear. Now let's solve some MCQ. We will just assess our knowledge whether we understood the concept or not. So if one MCQ came like the first infection caused by a pathogen in a previously healthy persons is called, and options like secondary infection, primary infection, reinfection and super infections. So what will be the answer for this MCQ? So according to me, if first infection caused by a pathogen in a previously healthy persons, according to me, answer should go with this primary infections. So initial infections occur in a healthy persons. जब healthy person के body में, शरीर में infection पहली बार arise होते हैं, that will be coming under this primary infection. So what will be the answer? Answer will be primary infection. Why not secondary infection? Because secondary infection means this is not the first time patient is getting infections. Already patient got that previous infection, due to that patient's body is compromised. That's why he got again and again the infections will be coming under secondary infection. That's why secondary infection is not the answer. What is reinfection? Reinfection means patient के पास already infection था, ना वो recover कर चुका है, then उसके बाद दोबारा उसका infection हुआ. That is coming under reinfection. But question में ऐसा कुछ नहीं बोला. What is super infection? पेशेंट के पास ऑलरेडी इन्फेक्शन है, पेशेंट रिकवर नहीं किया और उसके पास दोबारा एक न्यू इन्फेक्शन अराइज हो गया. That is coming under super infection. That's why super infection also not the answer. So what is the answer? Answer is the primary infections. Now the next MCQ. Next MCQ is a patient with measles later develops pneumonia. This is an example of superinfection, reinfection, secondary infection, primary infections. So what can be the answer? So according to me, answer should go with secondary infections. Why so? Because patient is already having measles. Okay, measles के वजह से उसका body's immunity decrease हो गया. Later he develops pneumonia due to the weakened bodies. That's why this is an example of secondary infections. Now why I didn't choose the option primary infection? Because patient is already having measles. This is the first infections. Later he got pneumonia. So it will be coming under secondary infection, not primary infections. Already दो infection इनके पास arise हो गया. That's why this is not coming under primary infections. Now why I didn't choose reinfection? Because here they didn't clearly mention about whether the patients recovered and then pneumonia develops, or before recovery patient develops pneumonia. They didn't mention like this. That's why we won't choose these superinfections and reinfections. So what will be the answer? Answer will be secondary infections. Understood? Now coming to the third MCQ. What is the third MCQ? Third MCQ is, let's think, MCQ is like that: infections that occurs due to overgrowth of the drug resistance organisms after antibiotic therapy is called. Option is, I'll give you two options: superinfections or secondary infections. So what will be the answer? Now understand the concept one by one or step by step. The answer won't be secondary infection, because here they didn't mention about whether the patient is getting these infections for the first time or second time or subsequently again and again and not. But they mention about overgrowth of drug resistance organisms after antibiotic therapy. That means patient is taking antibiotic therapy. Why I will take antibiotic therapy? If I am having or suffering with an infection, then only I will take antibiotic therapy, right? Now, due to this antibiotic therapy, resistance occurs. And due to this resistance only, another infections arises. New infections arises. So that means already patient is having infections. He is not fully cured. And then this new infections arises. That's why the answer will be secondary super infections, not secondary infections. I hope it's clear. Now coming to the fourth MCQ. When a person suffers again from typhoid after complete recovery, it is known as, option is reinfections, option B is superinfections. Let's give these two options. Now what will be the answer according to you? So according to me, if I give the answer, if I solve this MCQ, so I will choose the option reinfections, because after complete recovery, answer will be reinfections. Before complete recovery, if they mention, then answer will be superinfection. But as here it is mentioned after complete recovery, that's why answer is reinfections. I hope it's clear. So till now we have discussed total 4 classifications. Primary infections means for the first time patient is getting infections, that's why it will be coming under primary infection. Secondary infection means already patient was having primary infection, due to that body's immunity power getting low or compromised, that's why subsequently the patient is getting infections, that will be coming under secondary infections. Superinfection means patient is getting infections before recovery. You should mention this term, getting infections before recovery. Okay, or either they will mention in questions like due to antibiotic resistance organisms after prolonged use of antibiotic therapy. So patient is getting a new infections due to this antibiotic resistance. Why antibiotic resistance or why getting new infection? As because patient is taking antibiotic therapy for prolonged time. Due to this antibiotic effect, body's normal protective bacteria getting decreases. So the resistance powers also decreases. And that's why new infections arises easily. So before getting new infections is coming under superinfections, and after getting recovery. After recovery, patient getting infections will be coming under reinfections. And I solved total 4 MCQ from these 4 classifications. Okay, now coming to the 5th classifications. What is the 5th classifications? That is hospital acquired infections. Another name is this hospital acquired infection is your nosocomial infections. Okay, so what is this hospital acquired infections or nosocomial infections? So infection acquired ड्यूरिंग हॉस्पिटल स्टे, जब पेशेंट हॉस्पिटल में रहने के साथ साथ हॉस्पिटल स्टे करने के टाइम पे इन्फेक्शन अराइज होते हैं, एंड दैट वाज नॉट प्रेजेंट ड्यूरिंग द टाइम ऑफ एडमिशन. ड्यूरिंग द टाइम ऑफ एडमिशन पेशेंट हॉस्पिटल में भर्ती होने के टाइम पे इन्फेक्शन नहीं था. ड्यूरिंग हॉस्पिटल स्टे पेशेंट के पास एक इन्फेक्शन अराइज हुआ, एक्वायर्ड हुआ. That will be coming under your hospital acquired infections. Okay, so example is that a road traffic accident patient came to you, RTA, road traffic accident patient came to you with this complaint of leg fracture. Now he came to you with the expectation that he will be undergoing surgery. As he is unable to walk, so you provide him fractured bed and you did this Foley's catheterizations. As he is unable to walk, so he need to urinate in this bed only. That's why you inserted Foley's catheterizations. Now due to improper care, patient developed UTI after 3 days of admission. Okay, so that will be the examples of hospital acquired infections. So जब patient admission लिया था उस time patient के पास UTI नहीं था. Now after 3 days of admission, you did this patient's urine specimen test and you got this UTI. Why you got this UTI? Because you inserted Foley's catheter and you didn't do proper care. Because of that patient developed UTI. So that will be coming under your hospital acquired infections. Now let's solve one MCQ from this hospital acquired infections. So answer will be your hospital acquired infections only. Why I'm providing this MCQ? So that you will understand which kind of MCQ coming from this theory portions. So for that you need to clear your theory properly. So MCQ will be like this: infections acquired from hospital environment. From hospital environment after admission. After admission is called, and your option will be secondary infections. Your option will be nosocomial infection. Your option will be reinfection, or else your option will be opportunistic infections. Opportunistic infections. So what will be the answer according to you? So answer will be your nosocomial infections. Why? Because after admission in hospital environment, patient is getting these infections. That's why it is coming under your nosocomial infections. So answer will be nosocomial infections. Now coming to the 6th classifications, that is opportunistic infections. Now what is opportunistic infections? Opportunistic infections caused by organism or pathogen. Okay, due to its immunocompromised state. States. Whose immunocompromised states? Host bodies. ओके, एक पेशेंट का HIV से सफ़र कर, एक पेशेंट HIV AIDS से सफ़र कर रहे हैं. ओके, so you already know that HIV AIDS patients are severe immunocompromised. So if they are severe immunocompromised, easily they will get infected by various pathogens or microorganisms. As a result, easily they will get fungal infections, easily they will get pneumonia. So this kind of infections are most common, opportunistic, infections. Okay, opportunistic infections in HIV/AIDS patients. Questions came like this: most common opportunistic infections of HIV/AIDS patients. Your answer will be pneumonia. Why? Because this pneumonia, fungal infections arises in such kind of patients because they're severe immunocompromised. Now, if they're severe immunocompromised, easily microorganism can attack their body because their body is not having or not protecting from these microorganisms, as their defense mechanism decreases due to severe immune compromised state. That's why this is coming under your opportunistic infections. Now, if I give one MCQ from this concept, so MCQ will be like this: pneumocystis jirovecii, okay, in an HIV positive patient is an example of, okay, and your option will be opportunistic infection, option will be secondary infection, option will be iatrogenic infections, and your option will be primary infections. As you don't study about this in iatrogenic infection, so you don't think about this answer. So what will be your answer according to the previous concept? Answer will be opportunistic infection. Pneumocystis jirovecii is another most common opportunistic infections, okay, that cause in HIV/AIDS patients due to immunocompromisation state because they are severe immune compromised. Okay, now coming to the another infection classifications, that is your 7th, I think, iatrogenic infections. So what is iatrogenic infections? Iatrogenic infections means infection directly caused by medical procedures or treatment. What is that meaning? Meaning is that आप कोई प्रोसीजर कर रहे हो या फिर पेशेंट को कोई केयर दे रहे हो, वो प्रोसीजर और ट्रीटमेंट के दौरान पेशेंट को अगर कोई इन्फेक्शन अराइज होगा, so that will be coming under iatrogenic infections. So let's give an examples of a patient came to hospital, undergone surgery. Now, due to use of unsterile equipments, either any OT instruments or anything contaminated instruments, patient develops infections. Let's think surgical site infections. So that will be coming under your iatrogenic infections. How patient develops infection? Patients undergone surgery. You used unsterile equipments. You need to use sterile equipments in OT, in surgery. As because you use these unsterile equipments, patient develops infections. So that will be coming under your iatrogenic infections. I hope you understood. Now, if MCQ come from this topic, how examiner will form this MCQ? Like infection caused directly due to medical procedures or treatment is known as, your option will be nosocomial infections, your option will be opportunistic infection, your option will be iatrogenic infections, and option will be secondary infections. So as you already know the concept, easily you can answer these questions. That will be coming under your, that will be coming under your iatrogenic infections. I hope it's clear. Now, the last 3 minor classifications, 8th, okay, are typical infections. So what is atypical infections? Atypical infection means an infection that is not typical, as simple as that. So atypical infection means an infection that does not show the usual or classical signs or symptoms, okay, symptoms of a particular disease, So example is like patient is suffering with COVID-19. So you already know what will be the sign and symptoms of this COVID, like anosmia, patient won't get any smell, patient will be having severe respiratory depression, fever, etc., body ache, etc. But you already tested the patient's throat swab you got that patient is suffering with COVID-19, but patient is saying, no, I don't have sore throat, I don't have anosmia, anything. So that will be coming under your atypical infections. I hope you understood. Now coming to the inapparent or subclinical infections. Subclinical infection. So what is inapparent or subclinical infections? An infection where pathogen enters the body and multiplies, but no obvious clinical symptoms appear. So what is this inapparent or subclinical infection? All signs and symptoms are not showing by the patients. We know the definition of infections. Pathogen microorganism will enter the body, it will start multiplies, it will damage the surrounding body tissue, and sign and symptoms will be showing. But here patient is not showing any sign and symptoms. That will be coming under your subclinical infections. Example is like poliovirus infections. Poliovirus infections without paralysis. Patient is not having any paralysis, although patient is suffering with poliovirus infections. So it should show this patient will suffer with paralysis, but patient is not having any paralysis. So that will be coming under your subclinical or inapparent infections. Now the last classifications is that latent infections. So what is latent infections? Infection in which pathogen remains dormant. Dormant means what? Inactive inside body for long time. So that will be the latent infections. It can reactivate. ये तभी reactive होगा, कब होगा? जब patients immunity will get decreased. When immunity get decreases. Okay. So जब भी microorganism बॉडी के अंदर एंटर करता है, इट स्टार्ट मल्टीप्लाई, it damage the surrounding body tissue and showing the sign and symptoms. So different infections having different incubatory period, but when such infections taking long time, keeping themselves in active state inside the susceptible host, that will be coming under your latent infections. So what we have discussed so far, we have discussed in today's class all the major classifications of these infections like primary infections, secondary infections, superinfections, reinfection, hospital acquired infections, opportunistic infections, iatrogenic infections, atypical infections, subclinical or inapparent infections, and latent infections. We have solved MCQs from each infections classifications. I hope this class will be helpful for you all, making the notes properly and keep your preparation in track. Thank you so much, dear students.